Welcome back to ECCMID TV. We're now going to meet our guest from Paris, who's come all the way across from Paris, Professor Dr. Emmanuelle Cambau, who is the chair of a study group on microbacterial infection in Europe. And Doctor, you're involved with the hospital Lariboisiere and the University of Paris Diderot, I understand.
Yeah, you're right. I'm chairing this study group, which is focusing on microbacterial infection. And maybe for people not knowing about microbacteria, they involve tuberculosis that still exists in Europe, even Western or Eastern Europe. Also non-tuberculous microbacterial infection that are emerging, especially in northern countries. And also leprosy, because we can diagnose leprosy from immigrants coming to Europe. So it's quite important that we have a common strategy for diagnosis and treating these infections.
How broad is your study group? Who does it comprise?
Yeah, well, the study group involves clinical microbiologists, infectious disease specialists, and everyone interested, PhD, also interested in microbacteria. We are about 50 at the moment, but really among the experts in Europe.
Excellent. Now, ECCMID is always a magnet for everybody in your field. This is the ultimate congress, really, isn't it? The place that everybody wants to come.
Yeah, I try to come each year because, you know, enormous meeting, so many people, so many topics. We are involved every day in the lab, so it's really important to be there.
I know you also have a very busy schedule, and thank you for taking your time out to come and talk to us. But what motivates you, Emmanuelle, as a person at this Congress? What are you most looking for?
Well, I'm mostly looking, meeting colleagues, I should say, and share things together, all the knowledge and also the strategy, the capacity building we have. I think the most important is to meet, because, you know, during the year you can exchange emails or even pictures, but it's really important that we meet here.
And there's an awful lot of program to choose from as well, because not only the networking, but also the learnings. Do you try and attend some of the lectures, some of the symposia?
Well, I try to, but I think, well, it's quite easy today to learn from papers and PubMed reviews. So I still think the most important thing we have here is to meet people, discuss face to face, and sometimes get friends.
Yes, of course, and new colleagues and associates all the way through. There's a lot of technology being built into ECCMID this year, not just our studios here at ECCMID TV, but a lot of the papers, a lot of the e-posters, a lot of new learning and new innovation has gone in. Does that excite you? Have you found that interesting?
Well, I think it's very interesting for young people and young researchers and young medical doctors, and so, you know, there are more and more.
Yes.
Probably a third of ESCMID members are young, so they love that. So maybe I like less than they do, but I think it's important to do that because that's the way they are living and the way they will live in the future.
Doctor, when you leave the Congress and head back to Paris, what are you hoping to walk away with from this Congress? What would make you happiest?
Well, what I like usually is that bring back many projects and many new friends, I would say.
Excellent. Well, it's been a real pleasure having you here on ECCMID TV. I wish you a happy and successful Congress, and we'll be seeing you again next year in Istanbul, I hope.
Yeah, I think I will. And
excellent.
I will be happy.
Could you invite people in French for me to Istanbul?
Yeah. Rendez-vous au prochain ECCMID meeting à Istanbul en 2016.
Thank you very much indeed. A real pleasure having you with us. Thank you. Merci beaucoup.